Dr. Claytor here with Julie.
Hi, everyone. I'm the PA at Claytor Plastic Surgery.
So awesome today. We are talking about PRP. What is PRP?
Platelet Rich Plasma. So whenever you come in the office and we're doing a PRP procedure, we draw your blood, spin it down, and isolate that platelet rich plasma and utilize it in a bunch of different techniques. Topical injections, all sorts of stuff.
It really is the gold standard and widely accepted, and nobody has any trouble with PRP because it comes from that person and is used on that person immediately. So we draw your blood, we take out the platelets, we isolate them down, and then what we're doing is we take that PRP, platelet rich plasma, inside there are these platelets, and they have these little orange things which are alpha granules. And what happens normally in the body as it cruises around and it finds some sort of an injury, these granules break open and you get all these awesome yummies. You get PDGF, TGF, IGF, VEGF, cytokines, IL-1, IL-10, all of these different things that are very important in hemostasis, angiogenesis, pro-inflammation, improving cell biology behaviors, and they act as little delivery vehicles to bring things like exosomes to a wound healing process. So the body, when it releases these tiny little granules, it has these EVs, which stands for extracellular vesicles. And these tiny little things can be used to communicate back and forth between cells and come up with angiogenesis, pro-inflammatory wound healing things. But one of the most significant things that sit inside of here is a PDGF. What is PDGF?
Yes, PDGF is Platelet Derived Growth Factor. And you can see here that our body makes it naturally as well. However, we're also getting into manufactured PDGF. So one of the problems with PRP is it's very patient dependent. It depends on your age, your ability to make collagen and things, your comorbidities, your lifestyle. And a lot of that we can't necessarily control. So it's not necessarily predictable, which is where PDGF, platelet derived growth factor, that is a manufactured product, is consistent, it's predictable, and we can use it for everyone and get consistent results.
Wouldn't it be great if you could, rather than go through all this process of pulling the blood out and isolating it down to get a little bit of the PDGF, which we know is really effective, what if you could simply go to the shelf and pull off recombinant PDGF that's already been manufactured and is literally thousands of times more potent?
I think it's 300,000 times.
Would that be a benefit?
Yes, absolutely.
Fabulous.
Yeah.
So why do you think that there is so much discussion about this today? There's a little bit of apprehension and discussion, probably because it's new.
Yeah. I think any new product on the market, rightfully so, can kind of come up against some tension. And I think that's okay. However, I think as long as we are, consenting our patients, going over risks and benefits with them, as long as they are educated and understand, we can proceed with caution in a safe way. I think a lot of kind of the upheaval on the market right now is it being injected. We've used it topically with absolutely no issues.
We have a really great research study that we're just wrapping up, and we'd like to hold it as a bit of a secret until we have it published so that everybody can enjoy it and read it in its entirety. But I think the big point that we're trying to get across here is, what is PDGF and why is it important to be able to deliver it in a higher concentration and a higher level? And what is it able to do if you are able to deliver it in a higher concentration? So hopefully you found this helpful to demystify a little bit about what PDGF is, and also give you a little teaser about the research study that we're just wrapping up about the incredible positive effects that it can have on wound healing and improving skin color and consistency and removing a lot of the fine lines and wrinkles.
Yeah, I think the long and short of it is PDGF is only going to help your results. It cuts down that healing time because of the angiogenesis, that blood flow to the wounded area. It's going to help attract stem cells, which helps regenerate the area as well. So basically, it's going to boost your results, go over all those things that Dr. Claytor just mentioned, the pigmentation, fine lines, and then it's going to cut down your healing time too.
So hopefully you found this educational and helpful in your journey. Give us a call if you have any questions. And again, thanks so much, Julie.
Thanks.